One of the things that we take for granted many times until we get in trouble is our feet. Feet carry so much weight of the body. Whatever your weight, I weigh blank. Whatever is the blank, you put fill in the blank. I weigh that much. And both feet take care of my entire body when I'm up and about, standing, walking. Out of 16 hours that I'm up, I don't know how many hours you're walking, how many hours you're up. You can think about that. But all that time, the feet are the bearing of all weight. So I'm standing up now, I'm stable, but guess what? Somebody is bearing my weight, and that's my feet, bottom of my feet. Yes, you can say that I'm stable because these muscles are holding, that's holding, everything is fine. These muscles are there, but ultimately, who is the one bearing the weight? Feet. And so this part is basically taking care of the foot. And if you have situations with the foot, you will have extra care to take. Now, the main thing we will deal with is not um, that that we are aware of feet, or we need to be aware of all the things, but we need to see how sequencing we do it. So first of all, if you are able to lift up the foot, fine. Whatever extent you can do. If you need a little bit support there, you can do the support. And the first thing that you want to do is to look at it. Look and see if everything is okay. There's not much swelling there. And then if you have a mirror, that helps. Mirror to see the bottom of the foot and check out if there's any situation there. If there's any sore, if there's any problem there, you can check with the mirror. That's just important thing to notice. And then separate the toes. Look in between the toes. See if they're all okay. If there's some stuff that is there, you may want to have a little rag to clean it up, but just so that you keep it separate. Same thing the other side. Look at them. They have been wearing weight bearing. There will be a corn. There will be a little bunched up skin. Something there. Just check. That's just the checking part with watching it and seeing if there's anything going on there. If there's nothing going on, now we start working with the foot. Foot massage. Stand up first and feel the Mother Earth. Feel the floor. Check how the feet feel, how much weight there is, and what they are experiencing. You may go back and forth a little bit sideways to feel the foot. You can sit down, pick up one foot, and if you are able to lay it on your knee, please do that. If not, you can put it a little bit lower, wherever you need to bend. If you can do that, that's great. Now, let's see you're able to do this. And I'm going to rest it here so that you know that this also sometimes is helpful. What I want to do now is separate the toes. Separate the toes. Separate the toe. And then rotate the big toe. Circular movement of the toe, big toe. Circular movement of the second toe. Circular movement of the third toe, both directions. Fourth toe. And the fifth toe. Then up and down. toe up, toe down, toe up, toe down, toe sideways, loosen up that joint. Second toe up and down, sideways, third up and down, sideways, fourth and fifth. It takes literally a few seconds to do this. And then put your palm, all 5 toes, and up, down, up, down. Just the 5 toes, up and down. Move them around a little bit. Now you hold on to the front of the foot. Front of the foot, up and down, sideways. Front of the foot, up and down, sideways. Put your hand on the calf and move the ankle. Up and down, ankle, up. Feel the calf tightening, down. Up, down. Sideways. Feel that ankle. And then circular motion of the ankle. Circular one way, circular the other way. Hold on to it from the middle of the foot. Then, next thing you want to do, now you're supporting your weight on the other foot, as you know. Now you're going to squeeze and massage. Squeeze from ankle down, squeeze, massage going down, all the way. As if you are emptying, squeezing out something, throw that away, throw it away. Squeeze, squeeze, and all the way down, out. And then tap. You can do tapping with your fingers, knuckles, or palm. We do not do specific tapping. If there are organ systems that you are foot charted, that you are aware of, and you can put the foot chart in front of you and you can do specific tapping. This is just a general foot massage and foot tapping. Inhale and exhale at this point. We've been working on this. Inhale and exhale. And then go up with the ankle, squeeze. Now put the foot down. Stand up. Check if there is difference between one foot and the other. You just worked on one and the second one we were sitting on. Very likely, as I feel, very likely that foot is very light, hardly any weight on it. I don't feel the same weight as I do on the other foot. But that's the experience you have once you work with the foot. So let's work on the other one. Have us sit down again. And begin with the toes. I'm just going to say first toe, second toe, third, fourth, fifth. All toes. Sideways, up and down. Front of the foot. You may use both hands to do that. And then the ankle. Up and down, sideways, circular. Notice how that foot that we massage, which is now on the floor, how that feel. Still feel light? Or does that still feel? You have the foot on the floor right now. For me, I feel like completely light there. Ankle. Squeeze, 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 squeeze. Squeeze all the way. Throw the squeeze out. Remember, this is general foot massage. We are not really doing any specific points, but you may select the specific points from the foot chart. You work on that. They are all represented. Certain areas I think I need a little bit more attention, so I'm going to do that. Figure out what your needs are. Inhale and exhale. Bring it down. Once you're done, feel how they feel. To me, when I put it down, it's almost like I don't have any feet. Not much of weight there. Gently get up. Make sure you're stable. And walk a little bit. Is there any difference? Taking care of foot, particularly when you are walking all day or you go for a walk in between, go for a hike in between. Taking care of the foot, getting a foot massage, maybe a couple of times a day. When you're sitting in a chair, watching a movie, sofa, take care of the foot. These will carry us much distance and much longer in our life. Very important to take care of them.